Hey guys, it's Sarah here. So this is a Med-Surg Part 3 NCLEX review. This is the last review of the whole NCLEX series, and if you want to access that, just click on the playlist or go to my YouTube channel. And also, any of my NCLEX review videos, if you want them in a PDF form, please visit my website, or you can look at the link below, or go to www.sarah, that's with an H, so SARAH-RN.com. So let's get started. Okay. The first topic we're going to be talking about is liver and spleen. The first thing under liver that I want to mention is cirrhosis. Cirrhosis is progressive liver destruction, and what happens here is that the liver gets scarred. The scarring causes obstruction. The obstruction hinders the liver function. It is irreversible and it's progressive. You want to know symptoms. The main symptoms that you want to watch out for that are specific to cirrhosis are clay-colored stool, jaundice. Whenever you think of liver, think of jaundice, yellowing of the skin. You'll see in the whites of the eyes yellowing. Ascites is a symptom that is specific to liver, like really bad liver failure. And it's basically when they put out their arm, they'll be flapping it, kind of like tremoring it. Another symptom that's specific to liver, like progressive failure, is itching. And the reason for this is because the buildup of bile under the skin. They're going to have elevated bilirubin, ammonia is going to be elevated, etc. Complications for cirrhosis is hepatic encephalopathy, portal hypertension, ascites, esophageal varices. Treatment for this is going to be paracentesis. Paracentesis is basically the stomach is going to be very distended. They're going to put a needle in, take it out, and they're going to have to keep coming for it. As we said before, it's irreversible and progressive. So this is not like a one-time fix and they're good. Over here, we're talking about the complication I just mentioned. Hepatic encephalopathy is basically, it's a buildup of ammonia and it causes neurotoxic effects. So altered mental status. The symptoms honestly could range any neurosymptoms. So it could be from slight confusion to seizures and altered mental status. The symptoms that are specific that you want to think of that is hysterics, like we said before, the flapping when extending the arms, and flexor hepaticus. And what that is, it's like a musty, sweet odor of the breath. Treatment for this is going to be lactulose, because lactulose is going to lower the ammonia level. Like we said before, what hepatic encephalopathy is, a buildup of ammonia level from the liver not working, so you're going to give lactulose to lower the ammonia level. Okay, so ascites. What ascites is, it's a buildup of fluid in the abdomen, and usually occurs in patients with liver failure, like liver cirrhosis specifically. So the treatment, like I said before, is the same treatment for the cirrhosis is going to be paracentesis. They're going to keep going in, stick a needle in, take out the fluid, and they're going to keep needing that. So for paracentesis, you should know, like I just said, it's a procedure to remove excess fluid from the abdomen. It does not permanently treat ascites, so like I said, it's periodically. They're going to have to keep coming back for it. And you need to get informed consent. Before they do it, tell them to avoid. You want to assess their weight because you want to see how much they lost of fluid. And you want to place them in a high phallus position after so they don't get lethargy. Also, whenever you're removing a lot of fluid from someone, you always want to watch out is that they don't go hypotensive. Something else under liver and spleen, MRCP stands for magnetic resonance cholangiopancreatography, something like that. Anyways, it's a non-invasive test that is used to visualize the biliary, the pancreatic ducts, that whole area, via an MRI. What you should know is that it uses this called like IV or oral, like it's like a contrast, gadolinium. So you should know is that if someone's allergic to it, don't give it to them. That's it. The next thing is ERCP, which is that basically they put an endoscope down the mouth to the pancreas and the biliary duct, and then you could diagnose and you could treat once it's there. They can remove stones, put stents in that way, etc. Complication, you want to just watch out for when you put it in, perforation. Okay, so jaundice. Jaundice is a condition that basically causes the skin and also like the whites of the eyes. So you'll see in the white of their eyes, it's going to turn yellow. The cause for that is an elevated the bilirubin, and you just think of jaundice, liver disease. Whenever you think of jaundice and liver disease, also think of itching. The next thing is a liver biopsy. So the liver is very vascular. That's what you want to know. So with a biopsy, you want to get, the PTT, INR, check before, a type and cross in case they bleed out. So basically, you want to watch out for bleeding. Okay, pancreatitis. So pancreatitis is itis, inflammation of the pancreas. And it could be acute or it could be chronic. The main causes is cholelithiasis because they basically block the bile duct. Another cause is heavy chronic alcohol drinking. So sometimes they're going to have left upper quadrant pain or epigastric pain. It could radiate to the back. And you want to do the colon and Gray Turner sign. And with this is it's basically you're looking for a bluish, like around the belly and the flank, you're going to see like a blue discoloration. It's going to be diagnosed via lab, so the pancreatic labs like amylase and lipase, and the treatment for that is going to be first they're going to be NPO, then there is just supportive and symptom like relief, like pain medication, IV fluids. You want to monitor the blood sugar, avoid fatty foods which could irritate it and complicate it, etc. Spleen. So when we talk about the spleen, we should know that the spleen is part of the immune system. A lot of it is unclear, but it purifies the blood and removes the microorganism that causes infection. So if a patient has their spleen taken out, you want to watch out for infection because you just took out something that can help get rid of infection. Okay, now the next topic we're going to be talking about is wound care. Number one, a wound culture. So wound culture is like any other culture to identify which microorganism is causing the infection, just so that you should know which antibiotic to prescribe so it's more specific and it could treat it better. When you wash your hands, you want to remove the old dressing, disregard the gloves, wash the hands, put on the new one, etc. Dry dressing changes. So you want to use clean gloves for that. You do not have to use sterile gloves for dry dressing changes. Hand hygiene, clean the wound from the center outwards. You don't want to go from outwards and inwards. And you want to use a sterile gauze, but you don't need sterile gloves. And you want to dry the wound because if you have a moist wound, it could cause microorganisms to develop there. And whenever you have a wound, you want to monitor for infection. Negative pressure wound therapy is basically you put negative pressure on the wound and it takes away the bacteria. It includes like a vacuum pump and a drainage tubing and a whole dressing change, but it's mostly used for chronic wounds. Someone comes in with a little wound or small pressure ulcer, you're not going to use that. It's used for chronic wounds that don't respond to any other type of wound care. You want to give pain medication before then, etc. Wound irrigation. So wound irrigation is done before closing an open wound. You want to give them pain. Okay, so more about wound care. Jackson Pratt is basically a closed drainage that is placed after surgery. Let's say they have a breast surgery, and it prevents the buildup of fluid in a closed place. Over here, you'll see pictures on the side of both the drainage. A hemovac is like a Jackson Pratt. The only thing is that it could drain a larger capacity. So if you need something larger, you do a hemovac, as you see in this picture, and if you need a smaller one, you do a Jackson Pratt. You want to both empty them when they're half full. You don't want to wait till they're full to empty, and you want to monitor the drainage bags over here in the pictures like these for clots and signs of infection. Wound care. So when we talk about pressure ulcers, there are a lot of stages, and this over here is very useful, and you could find this below also. And it's very useful. You could just look at the pictures over here, and it says basically stage 1 is just red, no break in skin. Stage 2 is partial, but you don't see any, it's kind of like an abrasion, you know, like you scraped yourself open. 3 is damage to the skin. You'll see subcutaneous, you'll see yellow underneath. 4, you'll see tendon, muscles, you'll see white stuff underneath. Unstageable is when it's covered in black. It could be stage 1, could be stage 4. You don't know because it's covered in black, so you can't stage it. Deep tissue injury is when you see the purple or maroon area discoloration. Okay, a question. A patient has a pressure injury on the right elbow that's covered in eschar and extensive tissue damage. Then what stage should the nurse document this ulcer to be? Answer is going to be 4. It's stage 4. The reason for this is because you can't see what's underneath, so you don't know. Wound care. So under wound care, we also have dehiscence is an evisceration. Basically, the difference between them is that dehiscence is when a surgical wound reopens. So a lot of causes for that could be impaired circulation, like diabetes, who have impaired wound healing, stress, coughing, vomiting, stuff like that could open it. Prevention is if you don't want them to be constipated and be pushing and opening that, you could give them stool softeners, antiemetic if you don't want them vomiting. It really depends on what's causing them. Treatment for that is going to be surgical debridement or reopening to close the wound. Evisceration is when the surgical wound reopens, so that's the same thing as dehiscence, but the content protrudes out. As you see in this picture over here, here's when it's open and here's when it protrudes out. So this could occur, a few days after the surgery. Risk factors, same thing, obesity, diabetes. What you want to do is you want to stay with the patient. If you see this happening, call for help. Don't leave the patient. Cover the wound in a sterile dressing. Place the patient in low Fowlers with the knee bent. The patient is NPO, of course, and don't try to push it back in. That's the main thing. Don't try to push it back in, just emergency surgery. Neuro. So now we go into the nervous system. When we talk about the nervous system, we have first basilar skull fracture. This is a break in the bone at the base of the skull. These symptoms I would know they're very specific. So like I said, when we have specific symptoms, we should know them, not like nausea, vomiting, or something like that, or headache. These are very specific. So raccoon eyes, as you see in the picture over here, it's exactly as the name says, raccoon eyes, or post-auricle, which is like battle sign, which is over here, right? Over here by the ear, you're going to see that same thing. So for that, you want to test to see if there's cerebral spinal fluid leakage. So you want to test for dextrose. So you can test the fluid to see if it's dextrose. You want to know that blood is unreliable. So if there's blood in it, it's going to make the test unreliable. Blunt force trauma is basically, like hitting to the head. Severe complications could be brain damage, herniation, retinal detachment, seizure. Just think of anything in the brain. I would know the symptoms of retinal detachment. So let's say they say someone had a head trauma and they have these symptoms. You want to think of retinal detachment. Symptoms are going to be light flashing, floaters, or curtain-like effect in the visual field. This is an ocular emergency because it will lead to permanent damage. Okay, after head injury, the patient could have retrograde amnesia, which is when they do not remember. You do not want to give them CNS depressants because if you're going to depress them, you're not going to be able to know what their true neurostatus is. Like, is it from the injury or is it from the medication? Don't have them operate in heavy machinery because, they could harm themselves and other in the process. When we talk about aphasia, that is 3 different types. You have broncho, which is expressive, so they understand, but they can't speak, they can't express. Wernicke, which is receptive, which means they cannot comprehend what you're saying. Global is both. They can't read, write, understand speech. So it's the most severe form. Okay, we talk about trigeminal neuralgia. Trigeminal neuralgia is when you have intermittent severe facial pain that's triggered by light touch or hot, cold, chewing, something that's using that nerve. The main symptom is going to be severe electric-like pain along the cheekbone. And that's pretty much it. You should know for that is you want to give them pain medication. It is pretty painful. And, tell them not to eat stuff that are hot and cold, avoid rubbing it, and stuff like that. Bell palsy. So trigeminal neuralgia is cranial nerve 5. Bell palsy is cranial nerve 7, which is the facial nerve. This is caused by facial muscle weakness, and they're not able to close one side of the eye. Because of their symptoms are very close to stroke-like symptoms, because it's like one side affective, their smile is off on one side, they can't close one side of the eye or whatever. It's so specific to stroke, you want to rule out a stroke first. If they do have Bell palsy, you want to treat them with corticosteroids to decrease the inflammation. Okay, now we go into lumbar puncture. So lumbar puncture is basically an invasive procedure to remove a sample of cerebral spinal fluid. It's usually done to diagnose something like meningitis. It's a very sterile procedure, you should know. How you do it is they're made a sideline just like this, they put in a needle, and they aspirate it. They put it in between L3 and L5. The next thing I'm going to talk about is cerebral spinal fluid. You should just know what it should be like, because if you know what it should be like, then you know what's abnormal for it. So it should be no odor, no color, little protein, little glucose, little white blood cell, and no microbes. Intracranial pressure. Intracranial pressure is the pressure inside the skull. The skull is very balanced pressure. Anything more than it should have, it does not respond well to, because it's a closed system. So if you have more pressure in there, it can have detrimental neuro and life effects. Symptoms of intracranial pressure, they always test on this, is, well, if you have a baby, the fontanelles are going to be bulging, increased head circumference, and sunset eyes. Late symptoms are going to be the Cushing triad. And the Cushing triad is late symptoms because it indicates that there's brainstem hernia compression. And that's going to be, I would know the Cushing triad, systolic hypertension with a wide impulse pressure, bradycardic, and respiratory depression. Other signs they could have is projectile vomiting, nausea, headache, change in level of consciousness, ataxia, pupils dilation, seizures. They could also have, these are all different symptoms to just say neuro or ICP. They could have decorticate or decelerate. The way I remember that is because decor, bring everything to the core. So you see they're like in the top picture over here, everything is to the core and everything is out because you celebrate. Okay, later signs of intracranial pressure include which of the following: increased pulse pressure, projectile vomiting, decreased blood pressure, or narrow pulse pressure. So projectile vomiting could occur with increased pressure on the reflex center of the medulla. Okay, we're still talking about neuro when we talk about head injuries. So you have different type of bleeds. Subarachnoid hemorrhage is a bleed inside the brain, when the blood vessel ruptures and they're bleeding in the brain. The main symptom you want to know is they're going to say they have the worst headache of their life. Now, in reality, everyone says they have the worst headache of their life, even if they don't have a brain bleed. But for the boards, they have the worst headache of their life. Epidural hematoma is bleeding in a different place, and what you should know over here is that they go from no symptoms to completely out. So that you want to watch out for. Subdural hematoma is bleeding between different places, and symptoms could develop right away or even weeks later. Like we said before, in the head, there's no way for the pressure to go. So when you have a bleed, you have a lot of symptoms, and it can have very detrimental effects. So you have to get rid of it. You can make a burr hole or a cranial. Okay, now we talk about stroke or CVA, cerebral vascular accident. Stroke is when the blood supply to the brain is blocked. This could be due either to a blockage, which is ischemic, or bleeding in the brain, which is from a ruptured blood vessel, and it's called hemorrhagic. The signs and symptoms are fast, facial asymmetry. Everyone probably knows it's like the face drooping, the arm weakness, speech slurring, and you always want to know at the time. The reason you want to know at the time is because TPA is very time dependent. When they come in with a stroke, you want to do an immediate CAT scan because you have to see if they have a bleed or not. You always want to do a CAT scan before you give TPA or thrombolytic because it is only given in ischemic stroke. Because if they already have a bleed, you don't want them to bleed more. You should know TPA contraindications for that. And you should know that hemorrhages, whatever this word is over here, is basically when they lose half of their visual field on the same side. And you should watch out that they could neglect one side or safety, injury, all those type of stuff. Contraindications for TPA include a history of intracranial hemorrhage, active bleeding, surgery within 2 weeks ago, head trauma in the past 3 months, and if they're on anticoagulants the past 2 to 4 days. It must be given within 3 to 4.5 hours of the first symptoms. Now we talk about seizure. So seizure is when there's electrical disturbances in the brain. There's different phases: prodromal, oral, ictal, and post-ictal. There's different types of seizures. You have the tonic, clonic, you have both. I mean, they could go like this and then they could be nothing. You have tonic and myoclonic. What you want to do for seizures is all the same. You first of all want to note how long the seizure was, the symptoms. You want to call for help. You place pads side rails so they don't hurt themselves or fall over. You want to turn them to one side to open the airway and that the tongue doesn't obstruct the airway. You want to loosen their clothes. Suction should be right by them and never restrain them when they're seizing. You think to hold them down, never restrain them when they're seizing. An absent seizure in specific is usually in kids. It's when they have a brief loss of consciousness and then they come back. A lot of times it could not even be caught because they could just be thinking they're daydreaming like that, and you call their name and they're like that. So a lot of times it's just not even caught. Status of epilepticus is when you have a seizure for more than 5 minutes straight, and that's a medical emergency. The priority for that is to stop the seizure and you give them Ativan. Epilepsy is chronic seizure activity. They're going to be on lifelong anticonvulsion medication. You want to tell them to avoid risk factors for a seizure like sleep deprivation, alcohol, etc. EEG is a test used to diagnose. It's basically when they hook them up to, they put something around their head and they could see the electrical waves and they could see if they're going to have a seizure, and etc. ECG is really not done anymore at all, but it basically induces a seizure for 20 minutes, and it's actually done to treat depression, bipolar, and schizophrenia, but I just put it here because it has to do with seizure because it's inducing a seizure, but it's really not done. It's considered barbaric, honestly. I mean, the different sides to that. Okay, croup injuries is basically when they hit forward and backward. Think of a car stopping, all of a sudden you go forward and you hit right backwards. So I would just really know what the name is and what it means like that. You always want to put a patient in a C-collar whenever there's injury like that. Cervical spine injury. If someone has cervical spine injury, you want to immobilize the spine, C-collar in place, and when you move them, you want to log roll them. Next, we go on to tubes and ventilation. Tubes of ventilation are quite complicated, especially if you don't work in that field or know that field. But here I just wrote notes, and it's just in one thing. You could just read this in your time off. It's basically goes through mechanical ventilation, which gives spontaneous respirations. You have the non-invasive and invasive. Non-invasive includes CPAP and BiPAP. CPAP is continuous pressure. BiPAP is different levels of pressure. And if that doesn't work, you go to the more invasive, which is intubation. So if you can't put a patient on CPAP, BiPAP, they go to intubation. Intubation, which is like ET tube, is used to intubate them. Here are the steps to do it before. Pre-oxygenate them, medication to block their muscles, you need suction there, etc. You could also do a tracheal intubation, which could be done through a tracheostomy. Mechanical ventilation, there's different modes. You have assisted, control, pressure support. For the settings, you have the tidal volume, which tells you how much air goes into the lungs. Like if I was you, I would just pause the slide and just memorize this. Alarms, you have to look at alarms. There's two different types of alarms, high pressure, low pressure. High pressure means that there's resistance. Low pressure means that there's like a leak in the system, etc. Okay, when we talk about tubes and ventilation, we have NG tubes. NG tubes are placed usually when someone has a small bowel obstruction. They're placed through the nose and down. PEG tube is placed in the stomach, and there's like two parts. One's used for feeding and medication. A button tube is the same exact thing as a PEG tube. It's just used for confused patients because it doesn't have like a thing to pull, so they can't pull it off. Ways to confirm placement for NG tube is you want to check for the gastric residue. You want to check for pH. You want to auscultate, so you put your stethoscope and you push air in and then you hear. And X-ray is the only definitive way to confirm placement. So you don't want to use the NG tube or whatever until you have an X-ray. Okay, more about tubes and ventilation. A chest tube is used to remove air and fluid and to allow the lungs to re-expand. You have dry and wet suction for them, and wet suction comes with water that you put in it. You should see the bubbling. Dry suction does not come with water, and there's no bubbling. You want to keep the whole drainage system below the patient's chest and never milk it. Problems you want to watch out for: if the chest tube becomes dislodged, you should cover it with a sterile dressing and tape it on 3 sides. You never want to tape it on 4 sides because then the air can't escape. If a chest tube breaks, you want to insert the tubing into sterile water and get a new one. Question: a 7-year-old male patient is being evaluated for seizures. When you come into their room, you notice that they appear to be daydreaming. You time it, it's 10 seconds. After 10 seconds, they come right back. What type of seizure is this? Focal impaired awareness, atonic, clonic-tonic, and absence. D, like I said before, it's absence seizure, and they look like they're daydreaming. Okay, now we go on to cancer. So cancer is something very specific. The NCLEX doesn't really test on it much except for like warning signs and stuff like that. But there's really they're not going to ask you like which cancer medication is given for this specific cancer. Because it's very specific, and the NCLEX is testing you on stuff to make sure you're competent, safe nurse, not that you are an expert in oncology. So cancer is always diagnosed through biopsy. It's classified by what type of tissue it comes from. For instance, lymphoma, lymph nodes. Warning signs for this is caution. I would know that. That's just a mnemonic for that. And what caution stands for is change in bowel habits. A is for a sore that doesn't heal. U is for unusual discharge, thickening of lumps, indigestion, obvious change in warts, and N is for nagging cough. Radiation, there's two different types. You have the brachytherapy, which is internal radiation, and the teletherapy, which is external radiation. Internal radiation, you want to know that they are contagious. So first of all, anyone pregnant or under 18 should not go into the room to them. All staff should wear a dosimeter film badge. If the implant does dislodge, you want to first use a long handle forceps and a lead-lined container, which should be kept in the room in case that happens, because you want to contain the exposure. The external radiation is you want to tell them all different type of educations, like don't rub, scratch it. You want to patch your eye after bathing because you don't want to scrape the skin. It's very delicate and damaged. You want them to don't use like over-the-counter creams and stuff like that. No tanning, no sunbathing. They need sunscreen, and they should be in a cool environment. Chemotherapy, what you should know about this is it's medication that slows the growth of the rapidly dividing cancer cells. It's going to suppress, the main symptom I would know is bone marrow suppression, and so you want to watch out for visitors. You want them to have strict hand washing, no garden or fresh food that could have bacteria on it, masks them and the visitors, no raw food, no undercooked food, etc. Complication from chemo is tumor lysis syndrome, which is basically a rapid release of intracellular component into the bloodstream. Here's just different type of cancers. Like I said, we're just going to skim through it. Multiple myeloma. You want to, it's basically a type of cancer with white blood cells that help fight infection, and they clog up. So basically, it's like, if I had to describe it, I guess I would say is that it's when a lot of cells in the white blood cell, like all the cancer cells are taking up all the space in the bone marrow, so a healthy new white blood cell cannot be made. Testicular cancer is very common in young men, like very young, like under 35, from 15 to 35 area. A risk factor for that is undescended testes, and you want them to do testicular self-examination at home. Endometrial cancer starts in the inner lining of the uterus. Symptoms are going to be abnormal vaginal bleeding. Cervical cancer, what you should know for that is that there is screening to prevent it, pap smears, etc. Oral cancer, you should know the risk factor is tobacco use, alcohol use, and the most common type is squamous cell carcinoma. And that's when I said the non-healing ulcers, that's a specific symptom. The next cancer is bladder cancer. You should know causing is smoking, because smoking is a bladder irritant. When we go on to breast cancer, so breast cancer risk factors are females over the age of 50, because men could also have breast cancer, you should know. And one of the main risk factors are first-degree relative, like a mother or sister, or the BRCA gene. Diagnosed, biopsy, treatment for that is going to be a mastectomy. It's really diagnosed also through a mammogram, which is why we have yearly mammograms. Skin cancer, there's 3 different types of skin cancer. The most common type is squamous cell carcinoma, basal cell carcinoma, melanoma. Melanoma is not the most common, but it's the most deadly. Risk factors are going to be UV light exposure, outside, etc. You want them to do monthly skin checks, A, B, C, D, E. So you're looking for something like an asymmetry, a border regularly on our skin, color change, diameter, and evolving. Here's just a chart I made to see the difference between Hodgkin's lymphoma and non-Hodgkin's lymphoma. They're both cancers of the lymphatic system. Hodgkin's lymphoma, the cells that are involved are the Reed's Sternberg cells. They like to ask that for some reason. Non-Hodgkin's lymphoma has the B cells, and Hodgkin's lymphoma is more common in children, and non-Hodgkin's lymphoma is more common in adults, like over 60. So I guess you would say elderly. Okay, now we go on to shock. Shock is when there is not enough blood flow to tissues and organs. There's different types. Hypovolemic is from not enough fluid, so what you want to do is give them fluid. Vasogenic is from vasodilation, so you want to fix the cause. Why are they vasodilating? Cardiogenic is when the heart is not pumping enough, so in essence, not enough fluids getting around. So you want to restrict the fluids, and you want to do cardiac interventions. And distributive shock is two different types. You have sepsis, which is from an infection, so you want to fix the cause and give them antibiotics, or anaphylactic from an allergic reaction, which is give them epinephrine, and watch their airway. There's different stages for shock. You have initial, it's when the symptoms are starting. Compensation is when the body starts to compensate. So you're going to see the vital changes, increased heart rate, increased blood sugar. Progressive is when the compensation fails. So they're going to have electrolyte imbalance, cool, clammy skin. You're going to start seeing signs of shock. And refractory, which is final stage, organ failure, and irreversible. Which of these findings is the best indicator of fluid resuscitation for a patient with hypovolemic shock has been successful? Hemoglobin within normal limits, urine output within normal limits, pulmonary artery wedge pressure within normal limits, or MAP within normal limits. Answer for this is all are useful, but urinary output is what we use. Okay, now we go on to allergies. So, anaphylactic reaction is severe. It could be life-threatening. Symptoms could be like swelling of the lips, mouth, wheezing, difficulty breathing. They could have cardiac symptoms. What you want to do for this is you want to give them high flow oxygen, epinephrine, fluids if they need, bronchodilators if they're having trouble breathing. Latex allergy is a lot of times found in gloves. It could develop from repeat exposure or just that they have it. What you want to know about this is that if they're allergic to latex, most commonly they're allergic to other stuff. They have cross allergies, so you want to know like bananas, kiwis, avocados, stuff like that. Dust mite allergy is when it's usually found on beds, the dust mite. What you want to do is wash the linen every 2 weeks or 1 week with hot water, etc. Okay, allergy skin testing is when you put the allergen on the skin and watch the reaction. For this, you want to avoid antihistamines because that will, you want to see the reaction. You don't want the body not to, react. Allergic immunotherapy injection is when you give the allergen in the body so it can recognize and reduce the symptoms, kind of like a vaccine. Anemia. Anemia, there's a bunch of different types. Anemia is basically a lack of red blood cell or hemoglobin in the blood. I made this chart over here because there are so many types and you can see the symptoms and the differences. Iron deficiency anemia is from blood loss, dietary intake, they're not taking enough iron, pregnancy, bleeding, like menstrual bleeding, that they're losing too much. Symptoms of anemia are usually pallor, fatigue. Treatment is going to be you're missing the iron, so replace the iron. Aplastic anemia is bone marrow suppressant from cancer, radiation, medications, or viruses. Symptoms are going to be pantocytopenia, hemorrhage, so bleeding, fatigue, and pallor. Fatigue and pallor are very nonspecific for anemia. Like if they say fatigue and pallor, just think of anemia. You want to have reverse isolation for them because they're pantocytopenia. You want to monitor for infection. They may need a stem cell transplant or a splenectomy. Vitamin B12 causes are GI causes usually, like leaky gut, inflammation. Symptoms are usually numbness and tingling of the extremities and pallor. So they're deficient in vitamin B12, so you want to give them vitamin B12. Folic acid is usually from a poor intake, chronic alcohol use, drugs. Symptoms are going to be the same one as vitamin B12, and like we said, you're missing it, so give them folic acid. Sickle cell is genetic, but their crisis could be from like stress, dehydration, heights. They're going to have severe pain, jaundice, and fever, and you want to hydrate them, oxygen, pain meds. Question. A patient was diagnosed with iron deficiency anemia, is prescribed ferrous gluconate orally. Which should the nurse teach the client? Take Imodium, which is an antidiarrheal. Limit exercise for a few weeks. The stool may be very dark and it can mask blood. Eat only red meats and organ meats for protein. Answer for this is C. When you're taking iron pills, the stool could be very dark and it can mask blood. Okay, next we go on to contraceptives. So contraceptives are ways to not get pregnant. So rhythm is the most unreliable, and it's basically tracking your symptoms. So you track your body temperature, you track your vaginal discharge, and that's basically when you know when you're fertile, and during that time you don't have sex. The next type of contraceptive is the oral pills. The oral pills are regular birth control pills. There are two different types. You have the estrogen ones and the progesterone-only pills. Progesterone-only pills are given to breastfeeding mothers or people who are estrogen is contraindicated for. The main side effect for that is breakthrough bleeding. Oral pills like estrogen, those ones you want to be careful with for patients with clotting disorder or someone who's at risk for clots, like someone with coronary artery disease or breast cancer or stuff like that. The reason for that is it has increased risk for clots, thrombolytic activity. Side effects are breast tenderness, bleeding, nausea, and vomiting. You also want to tell the person on estrogen only or estrogen and progesterone pills that they should do a breast self-examination and don't smoke, because smoking can increase the risk of a clot and a breast self-examination, so you could catch if someone had breast cancer. Diaphragm is another way of contraceptives. It's basically a flexible like latex silicone device that's inserted before intercourse. It covers the cervix and prevents pregnancy. You have to resize when someone gains weight or loses weight, so you should know that. IUD is used for more long-term, so if someone wants to get pregnant within the year or 2 years, it's generally not used. Usually used if you don't want to get pregnant for at least 3 years. Basically releases small doses of the hormone over years. The two different types, number one is hormonal, number two is copper. The hormonal one lasts for around 5 years, the copper one lasts for around 10 years. For that, you want to know contraindication is someone with a history of PID or diabetes. And complications for that is abdominal pain, infection, they're not feeling good, the string could be longer, and because it's in for someone for so long, it could be infection. Emergency contraceptive is taken, it's basically to prevent pregnancy after intercourse. So all the other ones are to prevent pregnancy before you have intercourse. This one is to prevent pregnancy after intercourse, because you forgot you had intercourse and then you want to prevent yourself from getting pregnancy. You have to use within 72 hours, and it's really only used for emergencies. It should not be an everyday pill you're taking. Okay, so next we go into the eyes and ears. So cross eyes is called strabismus, which is basically as a picture. Over here, you see it over here. It's when one eye appears to go inwards and the other one could be going outwards or vice versa. You're usually going to see them squinting. This is actually normal until 4 months of age, so you should know that. What they're going to do to treat it is they're going to wear a patch over the strong eye to make the weak eye stronger, because you're forced to look through that. If it's not successful, then surgery. The next eye disease that we're going to be talking about is glaucoma. So So glaucoma is when there's pressure and it causes optic nerve damage. Symptoms you should know for this: halos, red eyes, loss of peripheral vision, vomiting. It does need immediate attention because it could lead to blindness. There are two different types. So you have your open angle glaucoma, where the symptoms are more subtle, and you have the closed angle glaucoma, where the symptoms come like suddenly, and that's an emergency. There is no cure for glaucoma, but you want to lower the intraocular pressure with medication. So for instance, Timolol is a beta blocker that's used for that. And the reason why you want to do that is to prevent optic nerve damage if there's too much pressure inside. The next one is macular degeneration. So this is actually like an age thing. When people get older, this is a normal thing that can happen to them. It's a gradual loss of central vision, so seeing straight ahead, but the peripheral vision on the side of them is intact. So basically you want to just help them with their ADLs and help them maximize their vision. Next one is cataracts. So cataracts is cloudiness. So it's basically clouding of the lens of the eye. It could occur at birth or even in older adults. So symptoms is going to be painless. That's the key over here. It is not painful. It's painless, gradual loss of vision, blurry vision, difficulty seeing, especially during the night. Treatment for this is surgery, and that's pretty much it. Okay, so next we're going to retinal detachment. So symptoms for that you should know because they're very specific. So retinal detachment is a sudden onset of light flashes, floaters in front of their eyes, cloudy vision, curtain appearance in their vision, and that's pretty much it. It is an emergency because it could lead to blindness, so you want to send them to the ER right away, and treatment is surgery. Retinoblastoma is an intraocular tumor of the retina. So it's basically a tumor in the back of the eye. Symptoms are going to be white pupils, lazy eye, red. Like over here, you see over here, it's a white pupil. There's no red, it's just white. Treatment for this is going to be radiation or chemo because it is a tumor, or unfortunately inoculation, like removing the eye. If someone has it, the siblings in the family should undergo ocular screening. And next we'll talk about Meniere's disease. So Meniere's disease is actually an inner ear disease because it's when there's too much fluid in the inner ear, but it causes an episode of vertigo. So the symptoms are going to be really, really, really dizzy. It's really painful actually. They could hear ringing in their ears, hearing loss, nausea, vomiting. Like it feels like that they're having like a drop attack, like they're being pulled to the ground. So for them, you want to do, or for whoever is dizzy, you want to do a fall precaution. You want to restrict salt because you don't want the fluid to build up, and you want to help them with safety during the attack. You know, they're not hitting stuff, they're not falling down. Medications could be given, like meclizine is the main one given. Here are other diseases that don't necessarily fall under one specific, like eyes, ears, like one specific symptom, but you still should know, and I didn't know where to put it. So we're going to add it here since we're almost done. So sinusitis is a sinus infection, which is basically swelling or inflammation of the sinuses. It could be acute, it could be chronic. Acute is usually from like a virus or bacteria. Chronic is usually from a lot of other health problems like asthma, etc. The symptoms for sinusitis could be severe facial pain, nasal congestion, discharge from their nose, fever, and treatment is usually supportive or antibiotics. Cellulitis is a bacterial skin infection, and causes are usually from strep or staph infection. You're going to see pain, not going to see it, but they're going to be painful. They're going to see redness, warmth, tenderness to the, like right in this picture over here, that's pretty much cellulitis. For that, you want to do a warm compress. You want to mark it wherever you see it, and then you want to see if it's spreading. You want to put a dressing, you want to elevate the extremities, and you give antibiotics. Gout. So gout is inflammation. It's caused by ineffective metabolism of the purines. So basically, uric acid accumulates in the blood and especially in the joints, which is why like the classic one is the big toe, but it could also be other places. It doesn't have to be the big toe. Risk factors are obesity, high lipid levels, insulin resistant, poor diet. Intervention, so you want to fix those, you want to lose weight, drink water, you want to have a low purine diet, and eat and avoid eating certain foods like alcohol, heart healthy diet. For medications, you could give NSAIDs because NSAIDs are anti-inflammatories, and like we just said, gout is an inflammation. You could give colchicine, also that's specific for gout. Some other diseases, acromegaly. Acromegaly is basically an overproduction of the growth hormone. Causes are from pituitary adenoma. Symptoms are going to have an overgrowth of the soft tissues, usually like the hands, the feet, the organs. So they're going to be like really tall and just complications. The main one that you want to watch out for is heart failure. Huntington's disease is an autosomal dominant disease. So basically, it only requires one copy of the affected gene. It causes progressive nerve degeneration. So they have impaired movement and swallowing, speech, cognitive, etc. The classic sign for Huntington is chorea, which is basically involuntary tic movement. This usually comes on between 30 and 50 years old, and they could actually die from neuromuscular and respiratory complications. There's really no cure, unfortunately, but they just treat the symptoms and, OT and PT. The next one we're going to be talking about is toxoplasmosis. So this is an infection caused by a parasite. It could be from cat feces. It could be from undercooked meals, contaminated water. The reason why you want to know this is because it could cross the placenta and it's very deadly for the baby. So that's why pregnant women should not be cleaning cat litter, should not be having undercooked food, raw stuff like that. Okay, SLE, systemic lupus erythematosus. What this is that it's an autoimmune disorder that basically causes chronic inflammation of all different types of the body. The classic question they're going to ask you is how it looks, and it's going to look like a butterfly rash, as you see this picture. That's like the classic thing of how SLE looks like. There is no cure for it, but they give immunosuppressants and immunomodulators. Stress could exacerbate it, so you want to avoid that, and that's pretty much it. For SIRS, which is Systemic Inflammatory Response Syndrome, so that's basically an exaggerated inflammatory response to a stressor. So think of trauma as a stress of the body, shock, infection, etc. And it causes like massive vasodilation, capillary leakage, and basically they go hypotensive, and it can even lead to end organ damage. So symptoms you're going to see first like small ones, then come like much worse, like fever, tachycardia, leukocytosis, tachypnea, etc. Treatment for this is aggressive fluid resuscitation, and you want to treat the cause. So if it's infection, you want to give them antibiotics, etc. Question. So the nurse is providing the discharge instructions of a patient with glaucoma. Which activity does the nurse instruct the client to avoid? So let's all that apply. So should they avoid bending over to tie their shoes, sitting with their legs elevated, to sleep on more than one pillow, blowing the nose frequently, and lifting objects weighing more than 10 pounds? It's going to be A, D, and E. Any action that could increase the pressure in the eye should be avoided. So, for instance, bending over, blowing the nose, lifting heavy objects, etc. Here are other diseases or just information you should know. Hypothermia. Hypothermia is when the body core temperature is less than 95 degrees Fahrenheit and 35 degrees Celsius. So risk factor, the main one is usually homelessness, because when they don't have a home and it's freezing cold, they're still outside. Symptoms could be mental status changes, shivering, impaired coordination, etc. When they come in, you want to do a sepsis workup on them and place cardiac monitors on them. And you want to gradually rewarm. You don't want to just rewarm them right away. You want to gradually rewarm. Frostbite. So frostbite is when there's injury or freezing of the skin and tissue due to extreme cold weather. Symptoms are going to have numbness, swelling, bluish, whitish colored skin. Treatment for this is, firstly, you want to remove their clothing, make sure it's not constricting, don't massage it, put it in warm water, not hot water, no heavy blanket. You want to give them pain medication, elevate the area, and look out for compartment syndrome. Okay, ray phenomenon is basically when there's like a spasm in the arteries that causes a decrease of the blood flow. It's caused by cold exposure or stress. It's very common in women, especially ages like teenager to 40 years old. Symptoms, the color is going to change. It's going to go from white to like bluish purplish. The hands go numb, fingers are cold, and when the blood returns, then it becomes red. So basically, it goes from white to blue to red. Treatment is going to be putting their hands in warm water and not hot water. Again, you don't want to. You want to gradually freeze it, rewarm it. You could really prevent this, cold. If it's freezing cold, you get gloves, dress warm, avoid extremity, abrupt changes, stuff like that. Okay, next to go on to Berger disease. What this is blood vessels become inflamed and swell. When they do this, they lead to the blood vessels to become black with blood clot. It's most common in young men with a history of tobacco, marijuana use, and no heart risk factor. Symptoms are going to be intermittent coagulation of the hands and feet. Over time, the sores can form on their hands, and ulcers could also occur. First of all, if you want to treat them, they should stop smoking. Second of all, they should avoid cold, restricting clothing. They should walk, pain medication, avoid trauma with extremities. Okay, so here are some other diseases. Obstructive sleep apnea, OSA. So what this is that basically it's when they're sleeping, the airway gets obstructed and they stop breathing for like a little bit. A lot of times the patient themselves has no idea. It's the partner who says that. They usually snore a lot with that, and then they'll have a period where all of a sudden they're like gasping for breath, and then they go back to sleep, and they have no idea. But someone sees it and freaks out. It wakes them up a lot, and even if they don't remember, it's just not a good sleep. It's very broken up. So treatment for this, well, first of all, they have a sleep study to diagnose it, and then they put on CPAP or BiPAP for the night. Next one is scleroderma. This is basically an overproduction of collagen. Collagen is like to tighten and hard the skin, so that's what happens over here. It's progressive and there's no cure. Treatment is basically managing the symptoms and complications. The next one we talk about is malignant hypothermia. And this is a muscle abnormality that is triggered by certain type of anesthesia medications. For example, succinylcholine is like the main one. Succinylcholine is a paralytic agent that's given by anesthesiologists, and it's usually given in the OR, and it could cause, someone could have malignant hypothermia from that. Symptoms, first they're going to have like a rigid jaw, tachycardia, tachypnea, and then later they have like muscle rigidity, hyperkalemia, cardiac dysrhythmia. That's very lethal. Treatment for that is the reversible of succinylcholine is dantrolene. The next one is autonomic dysreflexia, and this is basically a massive uncompensated cardiovascular reaction by the sympathetic nervous system. It is only in someone with spinal cord injury at level T6 or higher. It is very life-threatening and it's seen a few weeks or even years after injury. So causes for this are bladder irrigation due to distension, distended bladder. So symptoms are going to be their symptoms of too much sympathetic nervous system. So like severe hypertension, huge headache, they're sweating, bradycardia, flushing, etc. Treatment for that is you want to reverse the cause. So if it's caused by bladder distension, you want to catheterize them. If it's fecal impaction, you want to get that out. Tight clothes, you want to loosen the clothes, etc. And last but not least, you have the Marfan syndrome. Well, that is it's a connective tissue disorder that causes visual cardiac deficits. Causes for this, it's actually autosomal dominant genetic mutation. And the symptoms, just think of like Abraham Lincoln. Like that's pretty much how they look. They're tall, slender, really long body with like disproportionately long arms and legs. For this, you want to check the cardiac sounds, do EKGs regularly, beta blockers, just treat their symptoms. The next one and last one is Seizure syndrome, if that's how you pronounce it. And it's basically an autoimmune disorder also, and it causes inflammation of the exocrine glands. So exocrine glands meaning like affects the salivary glands, the lacrimal glands, and symptoms are going to be dryness, basically drying of the eyes, drying of the mouth, etc. It could also affect the cornea. They should, because it's very dry. They're prone to dental caries, oral thrush, etc. Treatment for this, honestly, there's no treatment. You just want to relieve the symptoms. Question. A patient with a spinal cord injury at T1 level complains of severe headache and anxious feeling. What is the most appropriate initial reaction by the nurse? Number 1, to calm the patient, make environmental soothing, assess for full bladder, notify the healthcare provider, and prepare for the patient for radiography. The answer is 2, because like we said before, autonomic dysreflexia happens in patients with T6 or above. And it's life-threatening, so you gotta treat it right away. So that's it for the Med-Surg section. This is my last video of the NCLEX-RN. I've uploaded all the NCLEX-RN videos that you have to know. You can look at the playlist up above. If you want this or any of my NCLEX-RN videos in a PDF form, please see my website. That's www.sararn.com. The link is in the description box and it's written right over here. If you have any questions, please email me, and otherwise, good luck.